time or give by 5 minutes extra. Now we are going to go to the panel discussion, which is going to be moderated by Dr. Mercy Korir. I hope and believe she's within the tent here. Dr. Mercy Korir. Ah, yeah, she's coming. Hebu mpe makofi ya kilo as she's coming over to the podium. Yeah.
Good morning, everyone. It's still morning. I'm happy to be here to join my colleagues from the medical fraternity, and I look forward to having a fruitful conversation. We'd like to have the two panels between now and 1 p.m. So I think technically then between myself and your lunch break, between your lunch break and I am between Kizungu imekata, but mmelewa. Okay, all right. So without much further ado, allow me to welcome the panelists for my session. George Gibore is not new to you. He's the Secretary General from KUKO. Karibu sana. Esther Somoine, the CEC Health from Kajiado County. Esther? Okay, good. Then Dr. John Kihama, the Acting Director, Health Workforce Administration, Kenya Health Human Resource Advisory Council, Karibu sana. And last but not least, Dr. Lucas Nyabero from the PSK. Daktari? All right, let's give our panelists a warm round of applause as they come to join us. So this is just a discussion to pick the minds of these panelists, particularly looking at the staffing issues, which we have been in conversations over for the last, now this is the second day. Okay, let me join you guys there. And allow me to start from the government. Esther, as a CEC, is the staffing that we see in the country, because, you know, health being a county function most of the time, is the staffing that we're seeing enough to provide healthcare services? And is it in line with the government's strategies in terms of providing accessible and affordable health? You can. No, just that.
Thank you, Daktari. My name is Esther Somoire and not Somoine. Somoire and CC for Health Kajiado. There's a very huge gap between what the county needs across all the cadres and what our budgets can allow. Most counties are actually, 70% of the county workforce is healthcare workers. And most counties have committed up to 35% of their budgets to health. So there's still a very huge gap between what we can provide, between the county needs and what we can provide as counties. So this can be sorted through, of course, increased funding to the counties. We have had a conversation since the onset of evolution of devolution of function and not devolution of resources for health. So I think that will come in later in this discussion. But yeah, so that's what I have to say.
Okay. Thank you. So naturally, allow me to go to Dr. Kihama. We know that the gap is huge, but what steps are we making to bridge that gap? It's been almost 10 years of devolution.
Thank you, moderator. I think in terms of looking at or solving the issue of gaps in the health workforce, we have a number of agencies that are working with in the government and that have direct or indirect involvement in terms of solving that issue. So we have the health sector. We know we have gaps, and we have said that and repeated that. We have Treasury, who are the holders of the purse, so they need to be in agreement with us. We have Salaries and Remuneration Commission, who are the ones who allow the usage of government funds. So we need actually to agree to have in agreement the executive and even the legislature on the issues of increasing or removing the ceilings for expenditure on the health workforce. And I think we have kind of provided solutions, but I think it's a wrong discussion because there has also been the issue of the bloated wage bill. So it's a discussion that's going on, and we have voiced our concern that just like the health sector, the education sector is able to employ so many workers to replace the ones that have gone through natural attrition. Just like the security sector is able to recruit so many workers annually to replace the ones who have left or to add in order to match the increase in population. The health sector should be able to do that. Thank you.
Thank you very much. Gibore and Dr. Nyabero, you represent healthcare workers. You've heard what the governments have said. Are you satisfied? Let's start with Dr. Nyabero.
I was hoping to be last because if COVID didn't teach us one thing, the one thing it taught us is what you think is not. We realized that we can do a lot more with very little. We realized we didn't have to get shipments coming in from Mombasa for us to take care of our patients. So what am I trying to say? Sometimes the straight line is not the answer. Thinking outside the box makes a difference. So how can we package our request for staffing and or remuneration as a value proposition? The reason why you say the military or the security is because we value that, and anything we want, we'll spend whatever we need to spend for that. Because for some reason, there's a boogeyman out there coming for us who never comes, but we still spend a lot of money for that. Yet the healthcare issue that is right here, we see it, we see our people suffering. We still don't think it's important to fund it. The question is, as healthcare workers, I'm going to put this on you, and I'm sure I may have to run away. I may need security. Ask healthcare workers, how are you talking or communicating with your leaders, politicians, and patients that I provide value that needs to be compensated? How do we package that information? And we don't go say, increase our prices, increase our number of cadres. We say, this is the value we need with 4, and the value we can give with 8 is much bigger. And this is how it affects the economic activity. Now they understand.
Thank you. Let's give him a warmer clap. I don't think you'll need any security. Gibore, your comments?
Yeah, I think that is why probably we are here, and we need to say, as a country, we have our projection and what we need to achieve. And good enough, we are talking about health, which is classified as a public good. And healthcare workers are one of the major components to achieve any service delivery, specifically to attain UHC, so to say. The country called Kenya, we signed a treaty during the global meeting in 2013, which adopted that the healthcare workers are a very important component in service delivery. So, and of course, we identified these healthcare workers like we are not having enough numbers. And then we said we have to work toward that. Then we have the staffing norm that provide for the number that we need to work toward achieving. And when you look at it, I'll give some specific example. Like we have close to 2,800 specialists who are serving the public sector, against close to over 7,000 projected. Like the general practitioners, clinical officers, there are 6,200 against over 20,800. So if you look at the number that we have, then you desire to listen more. What is the problem? Probably the policies are there. And these policies and laws that we provide for ourselves, including the international statute, are not decoration, are actually our desire to move toward a better nation where we are able to give services to our people when they need them. So for me, I'll say, since the devolution, we can acknowledge the increase in number of the health professional, but unfortunately, this has been affected in a number of ways because since then, we have chosen to create discrepancies in terms of employment, and even a number of them who we don't regard most of the time because of being neglected. They are not well regulated. Like the public, the community healthcare workers who are never referred as public health the health, human resource for health. What I mean is that they play a very crucial role in terms of regulation that do not exist anywhere, in terms of employment do not exist anywhere, in terms of service delivery, they are required. So acknowledgement for healthcare workers, acknowledging what they are supposed to achieve when you have them, it is another thing. So we need to agree that indeed we are not where we are supposed to be, and we have not prioritized the healthcare workers as it's supposed to be, but we look at them as a burden. And that is why we have never looked at them as an asset. For instance, when you build you put a structure for a health center, they call it development. When they employ healthcare workers, they look at it like a burden. So we should not be looking at healthcare workers as a burden, but as a development because it affects including our socioeconomic setup. Thank you.
That just made me think. You say that when you build the building, they see it as development. When you hire, they see it as what? Expenditure. So do you understand what I meant by value? The value is you can actually see that patient under a tree, right? So we shouldn't value, we have this thing also, we have to think outside the box. I'll give you a couple of stories, and I don't know how much time you have, but I'll give you a couple of stories of how you can change the world. A few years ago, I used to live somewhere else, and there's a guy called Bezos who came and started carrying books from he would go to the bookstore, buy the book, bring it to his garage, and send it. And everybody said, this is not going to work. It's one of the largest companies in the world now. He thought outside the box of how do we get books to the people. They sell something called a Kindle at a loss so that you can buy books from them, then they'll make money from the books. So they're not looking at the initial capital. They are looking at what comes down the line. Number two, Elon Musk. When he started saying, oh, cars can drive on solar, people were like, what is this? Right now, each and every car company has a section that does exactly that. So he changed the world that way. Right now, they're looking at hiring healthcare workers to practice at the top of their license as a burden, right? That's what they're looking at right now. How do we change that to the fact that if I am down 2 people in the pharmacy department, I don't have 2 pharmacists, the value is, what they lose is this. And we can do that by studies. People don't argue with studies. You call a couple colleges, get somebody to fund this. You have a study that says, hey, this is what we're going to do. Now, I'm not saying they're going to capitulate and say, yeah, let's do it. But the thing is, when you start showing evidence that we are valuable and that we are important, they are not seeing it right now. They see the value in the building and getting all this equipment that they can't even use because they don't have enough people to run the equipment.
Any comments from the government side, especially on the value proposition? What is happening to see healthcare workers as part of the development and not an expense? Dr. Kihama, you're smiling.
Thank you. I think we have, from the health sector and the leadership in the health sector, we wouldn't see the workers as a burden. But I think from the sectors that provide us with the resources, we have a wrong way, like Dr. is saying, we need to package our message to show them what value is there in our workers. Otherwise, as in the health sector, we appreciate that you won't be able to run that system without the healthcare worker. But we need to get the other sectors that are working with us in recruiting and employing the health workers to understand the value of that worker to the system and how the system would not function without them.
Esther?
We don't see healthcare workers as a burden. But yes, I agree that we have been expanding our infrastructure. We've been expanding our services in our facilities. And we actually tried to adopt more flexible engagement terms for healthcare workers. That includes, of course, hiring staff on contract and locums, like the private sector. And of course, the unions on our case. They said healthcare workers must be hired on permanent and pensionable terms. But there is need to engage the other stakeholders. There is need to sensitize the National Treasury, the county assemblies, and all the other stakeholders, as Dr. Kihama says, they need to be sensitized on these issues. Because like for the county, it has always been, the executive versus the county assemblies. So there is need to sensitize all the other stakeholders on these issues here.
I'll come back to you, George, but just to Dr. Kihama and Esther. It's time and again, we are talking about we need to sensitize, we need to collaborate. We're always talking, we're always in conversations, in meetings. Why aren't they bearing any fruits?
We have actually come a long way, Daktari, because I have had the privilege of serving since the onset of devolution, since 2013. And I actually managed the devolution of healthcare workers in the county as a vice chair of the County Public Service Board. We inherited a lot of issues, backlog, and pending promotions from national government. We had a lot of issues in the first years, but since we started to engage with national government, we had a lot of support from Public Service Commission, and that is why actually we were able to resolve a lot of issues that we inherited in 2013. So yes, it's working, and maybe then now we need to start engaging the other stakeholders. But within the health sector, we now have committees that we sit jointly with national government and the Council of Governors. I sit Dr. Kihama in the HRH committee for the MOH and COG. We have a health financing committee. So maybe we are not yet there. Yes, we've been engaging since 2013 and we may engage again for another 100 years, but we'll get there. Thank you.
Yeah, I think let me probably take back the word burden and probably refer to as a liability. Yeah,
That sounds worse.
why I'm saying that is because you look at how healthcare workers have been battered. If you know the danger is coming and you're holding your baby, do you expose your baby or you protect and expose yourself? That is what I'm trying to talk about. Until we value the healthcare workers, look at the impact that is likely to cause if we really put it and strategize to ensure that it is progressing. Now, when I talk about that, I normally look at it, how difficult it is for you to get promotion despite existing policies. How difficult it is for you to be released for training despite existing regulations and guidelines. But who establishes the guideline and all those regulations that I'm talking about? We, I mean the government, because the government is we. Because the government does not exist without the people. Now the people, we establish those, but there is someone who must guide the implementation of those policies. The person we put in office. Now, if not implemented, then that is where we look at what we call policy gaps or even lack of implementation. Now, when I need to say that this is the reason why probably we have this conversation and trying to actually say, if today we say we are going to change the way we look at the healthcare workers, mentioning, so to say, why I say that is because you have a whole government meeting in what they can call a convention or even, because it was under the Council of Governors conference in Kirinyaga, where they resolved that they were going now to employ healthcare workers in contract form, short term. And where they are sitting, at that time, the governor had actually fired healthcare workers. I look at it, is that devaluing or valuing healthcare workers? And that is probably why I look at it and say we need to come and talk to each other and get to make ourselves understood the way Dr. is talking about how do we present the message that we are making to the government. But you must be given that platform for you to make your case. If there is no platform to talk, if there is no platform for you to present your case, how will you be understood? You looked as an enemy. So for you to make yourself very clear, for instance, we normally say union are not anti-government. Because when we say employee or you negotiate for CBA and members are awarded, the next year, someone going for election will say, I employed, I awarded, I increased the money. It is actually their credit, so to say. And that is why I need to end.
Thank you. Let's give him a round of applause. So, Dr. Nyambero, where is the role, apart from engaging, definitely, but where's the role of professional associations like yourself and the unions to fast track some of these things? Because we've been engaging 10 years. I don't think we should wait for another 100.
Absolutely, I agree with you. So this is a tough one because this requires some tough love also. I think, as I said, we need to look at things from a different, I know I'm a different voice completely. We've got to look at things from a different way. We have to set we have to invest on messaging and how do we package ourselves afresh. So the role of an organization like Pharmaceutical Society of Kenya is, and I have started engaging in this also, is how do we make sure that the pharmacists are the best professionals, they work at the top of their license such that you don't question their professionalism. That's value. When somebody is absolutely, we hardly question pilots. what is the error rates of airlines? We always assume you get on an airline, you'll get there. They have a safer record than healthcare, right? They're professional, they'll come in their suit, whatever they do, and they do it, they'll talk to them, but they will be very professional in how they do it. How can we be professionals in our own right? I'm not saying you're not, don't take that. I'm not saying you're not, but I'm just saying, how do you up your game as a professional? Then the leaders, how do we repackage the message? And when we go there, we are going there as saying, let's not talk about the salary, right? Because as I said, purchasing, when they pay you, they're purchasing your services. Purchasing decisions are emotional decisions, hardly logical. That's why you find people being paid, somebody's being paid a lot of money, and then you look at what they do, what is the value towards everything? When we purchase Kim Kardashian's rubbish, we pay millions of dollars for that, and we don't want to pay for CEs, right? Because CE is not fun. So how do we repackage ourselves for that so that we show value? And I think that is a role of the professional organizations also, so that as you go bad cop, good cop, you go there and argue, come back and tell my folks, hey, let's be professional, and then let's go and talk again. How do we build that value? How do we change that paradigm from we want to say, here is a value, what would you pay for this service? Okay.
Thank you. That's from professional, what the role of the professionals is. So if I got back to the government, both ministry and CEC Kajiado, what do you expect of the healthcare workers and the association so that they support you to be able to implement and fast track some of the decisions, and the strategies that are there to make sure that that gap you talked about is bridged? I can start with Dr. Kihama.
Thank you. I think the healthcare workers are doing their job to arrive, and we expect them to continue doing their job. Of course, there have been a few mentions of issues of absenteeism and what has been described as presentism. You are there and not doing much. But we expect the health workers to present. They have said 90% they have done what's expected of them. The remaining 10%, try to get it done. Also, try to get, at whatever level, get the leadership to understand what you are doing and what it involves, so that they can see it clearly. Don't assume. Even if somebody saw somebody dying there on the floor, they may not take it very as seriously as you know what has happened. But let get the leadership to understand what it is we are doing, how vital it is, and why we need what we need. Not to just give them a list and tell them I would need this by next week. Why do you need it? Let's not assume they know, because we have a lot to explain. And our moderator will tell you, like, the organization where I'm working currently have been deployed there from the Ministry of Health, the Kenya Health Human Resource Advisory Council. The main aim is to get the policy and the policy makers to understand what the health workers are doing in terms of the technical work they are doing, why they do it the way they do it, why you won't have an 8 to 5 job for a health worker, why you have one coming in the morning, another one afternoon, another one night. You get them to understand and get to review the policies that have been there, so that they recognize the unique nature of the work of the health workers. So that's so that we also expect the health workers to put in their best, so that even as we argue about how vital their work is, everybody will be able to see it. And unfortunately or luckily, or whichever way you look at it, for example, when we had the COVID pandemic came in, everybody appreciated the work of the health workers. But unfortunately, we were not able to run fast enough to ask them not to do Jerusalem for us, but to understand why they need to get us to keep motivated and get us to remain where we are, and also get us to increase our productivity so that even if we remain few for a few more months, those who are there, when they are very well motivated, they will increase their performance and do a bit more. Thank you.
Thank you, Daktari. Let's give him a round of applause. Then, Esther, what do you expect of the healthcare workers?
Of course, we expect healthcare workers to do their part. I said I was in the public service board before, and I would recruit a clinical officer or a nurse from a private facility. I would say poach, and because sometimes we get very good reviews, and even during recruitment, even the public will come and say, in Shalom Hospital, there's a clinical officer, anaitwa fulani, please get him to our referral. And I would actually go and get that officer. But they come to government, they get 4 times what they get from the private facility, but they won't even wait for the next officer, akuje shift. Ikifika 4 or 5, they're out. So we expect you to do your part, so that then you can demand, all these rights, implementation of the CBA. I had a case in Ngong Hospital the other day with a medical officer. We lost a mother who was referred from a lower level facility. And this officer, a medical officer, said she has a back problem. And 3 weeks later, she's in my office wanting to go and specialize. She wanted to go and do surgery. She has a back problem. And we lost a mother in that facility. Huyo officer akiwa hapo, she said she has a back problem. And now she wants government to sponsor her to go and do surgery. So that I throw to you healthcare workers. What was I supposed to do? And the following week, the union was in my office. Please, this doctor, you've released everyone else, so it looks like ni personal. And I said, of course, it's very personal because I'm a mother. Besides being a CEC, mimi ni mama. So, and I'm a leader. So when you don't do your part, it is very difficult for you to get the goodwill, even from the public and the leaders, because the reputation that public health workers have is. So anyway, Daktari.
It's terrible.
Sawa sawa. So we expect you to do your part. We will do our part. Thank you.
Thank you. Kibora, I'll give you the last voice.
Okay, thank you. Probably I'll try restrain myself and focus on what others have referenced, but of course, looking at what is provided for us as the union and the association. The association looking at our professionalism, our conduct, our moral, how we need to conduct ourselves in our premises when we are offering services. I think I agree that indeed we have some rogue officers who does things beyond even their job description. And I think I go to the Bible where Jesus entered and there were people doing some business in the church. What did he do? He actually had to discipline them. Then we normally say, as Christian, you rebuke yourself. Do we rebuke ourselves? But to such an extent, I need to say, we have what we call governance, leadership and governance. The people you lead, you have to model them to do what you want. And probably that is why the person in the private sector is doing very well. You bring him to the public sector and he's like, is this the person I brought? So who is the problem? The system. It is the leadership. It is the governance. Because they say samaki kichwa ikishaoza, ameoza mwili yote, si ndio? So we are trying to look at what is the problem so that we address the problem, because if you do it in piecemeal, this problem will never change. So you only the same monkey changing the trees. And we really need to encourage to look at what is the problem. And that is what we'll call like governance, leadership. If that person who is the supervisor is a person who come for 1 hour and I go away. And indeed, I normally ask, if I go to the private facility like Nairobi Hospital, the consultant there have time including to educate me on my long-term illness. In the government facility has got no time. Actually, unaingia ameshaandika prescription. So where do we get this attitude? Is it because we have provided that space? Then probably that's what I'm looking at. But I need to say that indeed, when you find where the problem, the etiology, the causes of this problem is, then you will address the problem. If I come in an institution you have given me to lead it, I'll not look at individual, I have to look at the whole system. So if you cannot toe the line, then why are you a professional? Because professionals restrict themselves to them. And as a union, when we are there, we will look at what does the law provide for us. We do not represent what I can call criminal, so to say. Thank you.
Thank you very much. Let's give the panel a round of applause. And I think what we pick and talking about, that we need to do our bit is that as healthcare workers, we carry the collective image of the group. So if the group in public health is what we've had, then whether you're hardworking or not, you carry that image. So I think the onus is on us to do our bit, as we've been told,
Doctor,
but also...
A minute. Probably I need to say there's an analogy that the doctor brought, comparing healthcare workers with the airline guys.
Yes.
But I need to say there is a different thing, because they deal with the class. The people who use the airline, they are not exposed to the public, and you cannot compare them with us. For instance, these people you deal with, they are the decision maker. They always have direct association to them. For us, we have been distanced by the decision maker. They never even seek services in our public facility. They do not know the problem we have. So probably what I need to say is that we really need to make a policy shift where they can seek services, where we are offering services, for them to know the value of a healthcare worker and probably acquit them the same. And that is why probably you'll never see criticism about military, but the police are always, because they are exposed to people. But if you let one day the military to be offering the services within our community, then you look at it in a different way. Thank you.
Thank you. Thank you very much. You have given the other point of what you expect of government, that they seek healthcare services where they are investing in and saying they are leading. So I think I personally support that point, because that's the only way you know where the shoe pinches. So we can start with Esther there and Dr. Kihama.
I do get services from Kajiado referral.
Perfect. Let's give her a round of applause. Okay. Then yes. The other point that the panelists raise is that as healthcare workers, you need to present your value proposition to the representatives like Dr. Kihama, so that when they're representing us in those meetings where we don't sit in, then they speak the language that we are speaking. And then key to what you said is leadership and governance, which is quite important, and that cuts across everywhere. So thank you very much. I want to end that panel there. Dr. Peterson, I'll give you a chance in the next panel, because we need to have a presentation. So allow me to thank my panelists, Dr. Kihama, Esther Somoire, George Gibore, and Dr. Lucas Nyabero. Thank you.
Thank you. Oh, sorry. Thank you, Dr. Masi Korir. And the discussion was very lively. We are going to have a presenter, and thereafter we are going to have another panel discussion before we break for lunch. I will call upon Andrew Pound, Managing Director, HPI. HPI is Health Professionals International. His job is career advisory and recruitment. He has 30 years experience in emerging markets. What he's going to talk is about international labor markets. So, Mr. Andrew, can you come forward? As he comes, can you give him a kilo?